Imagine losing your health insurance, not because you broke the rules, but basically just because you couldn't navigate a broken website.
Yeah, it's a terrifying scenario. And, for millions of Americans, it's rapidly becoming a reality.
Right. So, welcome to today's deep dive. We are looking at something that is urgently going to affect a lot of you out there. Back in July 2025, Congress pretty much completely rewired the American healthcare system.
They really did.
Yeah, they passed this thing called H.R. 1. It was a massive budget reconciliation bill. And, for those of you who don't follow the dense mechanics of Congress, budget reconciliation is basically just a fast-track process.
Right. It lets lawmakers pass major spending changes without needing, like, a supermajority to overcome a filibuster.
Exactly. So using that fast-track power, Congress instituted this sweeping new mandate. And the clock is ticking. By January 1st, 2027, adult Medicaid recipients across the whole country have to prove that they work, study, or volunteer 80 hours a month just to keep their medical coverage.
And the Congressional Budget Office actually ran the math on this. They estimate this one single change is going to save the federal government $344 billion.
Billion, with a B.
Right, with a B. But they also project it will strip Medicaid coverage from 4.8 million people.
Which is just a staggering number.
It is. I mean, that $344 billion figure, it represents this monumental shift in how the American safety net actually operates. We're essentially looking at one of the largest policy experiments in modern history, balancing, these massive taxpayer savings against the healthcare access of millions of people.
Exactly. So our mission today is to cut through the political noise and just look at how this machine actually operates. We're going to dig into government data, some think tank modeling, and real-world evidence from states that are already bracing for impact.
And just to be crystal clear up front, we are taking absolutely no political sides here today. Our goal is just to lay out the arguments from lawmakers who, want to reduce poverty and save money, right alongside the hard data from researchers who are tracking how these policies actually impact everyday people.
Right, just the facts. So let's start with the federal rulebook. What does H.R. 1 actually do? If you peel back all the legalese, it essentially acts like a countdown clock.
Yeah, it targets able-bodied adults, basically anyone between 19 and 64 years old.
Okay.
If you fall into that category, you have to hit that 80-hour mark every single month. And we need to be very specific about who we're talking about here. This primarily impacts individuals who got health insurance through Medicaid expansion, right? So adults earning near or below the poverty line.
But there are exemptions, right? Like the federal government does allow some exceptions.
Oh, absolutely. Yeah. If someone is medically frail or pregnant or, acting as the primary caregiver for a dependent, the 80-hour clock pauses for them.
Okay, and this seems like the burden of proof rests entirely on the individual, right?
Yeah.
Like, you don't just get to say, hey, I'm a caregiver, and they just take your word for it.
Right, exactly. The proving part is the absolute linchpin of this entire law. States have to conduct what H.R. 1 calls a look-back period.
A look-back period. What does that mean, practically?
So when you apply for Medicaid, the state government has to pull your work history for the previous 1 to 3 months to verify you're actually complying. And then once you're actively in the system, they can't just leave you alone. They're legally required to review your status every 6 months.
Wow, every 6 months.
Yeah. They have to constantly confirm you're still logging those 80 hours or that you still hold a valid exemption.
So let's look at why lawmakers want this. The politicians who champion this bill, they point to a very specific long-term vision. Like Missouri Representative Darren Chappell, he outlined this core argument really clearly.
Right. The proponents believe this policy acts as this vital catalyst.
Exactly. They argue that by requiring 80 hours of work or job training, the government essentially pushes people into the workforce. They build new skill sets. They climb the economic ladder.
Yeah, the ultimate goal from their perspective is that these individuals secure health insurance through a private employer, right?
Yeah.
Like lifting them out of poverty permanently while simultaneously saving American taxpayers billions of dollars.
Which, the financial goal makes logical sense on paper. You want people to be independent.
The underlying philosophy is really that government assistance should function as a temporary bridge, not a permanent destination.
Right. But, okay, I have to push back here. The mechanics of actually tracking those hours, it seems kind of impossible.
The massive hurdle, yeah.
Like, how does a state government actually track 80 hours of work every single month for literally millions of low-income people? We're talking about folks who might work erratic shifts or juggle 3 part-time gigs, or they get paid in cash and lack formal salary documentation. Building the administrative apparatus to monitor all of that just sounds like a bureaucratic nightmare.
Well, the thing is, we actually possess hard data on what that bureaucratic apparatus looks like when it goes live. Like, we don't have to just sit here and guess with theoretical projections.
Because a state already tried it.
Exactly. The state of Arkansas built this exact system back in 2018.
Right. They operated under a federal waiver.
Yeah, so a federal waiver, it essentially gives a state permission to break the standard Medicaid rules so they can test out a new idea. Arkansas requested and received permission to roll out an 80-hour work requirement that is almost identical to what H.R. 1 is mandating nationwide right now.
Okay, so what happened?
Well, they launched the system, they gave residents a few months to sort of understand the new landscape, and then they started enforcing the rules. And by the end of 2018, Arkansas had kicked more than 18,000 people off the Medicaid rolls.
18,000 people lost their health care in just 1 year. Wow. And, I think the immediate assumption a lot of people might make is, well, those 18,000 people simply refused to work. But that's not what the data shows at all, is it?
No, not even close. The Brookings Institution did this massive analysis of those disenrollments, and they uncovered this severe disconnect between human behavior and what the government data was saying.
What did they find?
So they surveyed the targeted population in Arkansas, and the survey data indicated that only about 4% of those individuals actually failed to meet the work requirement.
Wait, really? Just 4%?
Just 4%. The overwhelming majority were either already working the required 80 hours or they had a totally legitimate medical or caregiver exemption. Yet the state of Arkansas officially labeled 27% of enrollees as non-compliant and just stripped their coverage.
That is wild. It's like, it's basically like failing a class, not because you skipped the homework, but because the school's online portal crashed and wouldn't let you click submit.
That's a perfect analogy.
Like, almost everyone followed the rules, but the state threw them out anyway.
Yeah, the Brookings research concluded that the vast majority of people who lost health care in Arkansas, they didn't lose a battle against employment. They lost a battle against red tape.
So we have to explain the why here. If you are working the 80 hours, why on earth is it so incredibly difficult to just tell the state government, hey, here is my timesheet?
Well, the barriers were incredibly systemic. First off, Arkansas initially required enrollees to report their hours every single month using an online-only portal.
Uh-oh.
Yeah. And in 2018, Arkansas ranked near the absolute bottom of the United States for household broadband internet access.
Oh, wow. So you had massive swaths of the rural population who physically could not even get online to fill out the form.
Exactly. And even for those who, say, managed to find a computer at a public library, the system itself was just a maze. Enrollees described the website as, like, visually complex, glitchy, poorly designed. It required secure logins and documentation that a lot of people just didn't carry with them.
And I imagine the communication breakdown started long before anyone even reached the website, right?
Oh, absolutely. The state tried to notify people about these new rules through the mail, but the insurers operating in Arkansas reported this staggering failure rate. They estimated that only 10 to 15% of their informational mail actually reached the intended recipients.
10 to 15%. That number sounds absurd. But then you consider the reality of living near the poverty line. Housing instability is a huge issue.
Right. People move frequently.
Exactly. Leases expire. They stay with relatives. They transition between temporary living situations. If you lack a permanent forwarding address, a government warning letter about a new website portal is just never going to find you.
And on top of that, if the letter did somehow magically reach an enrollee's mailbox, comprehension became the next massive hurdle.
Right. What do you mean by comprehension? Like the way it was written?
Yeah. Experts analyzed the notices sent by the state. The letters were written at an 8th grade reading level, and they heavily utilized dense bureaucratic jargon. But literacy experts noted that the targeted Medicaid population really required materials written at a 4th grade reading level to ensure clear understanding.
Yeah. So you had individuals working 40 hours a week, totally fully compliant with the law, who literally did not know a website existed.
Yep.
Or they just didn't realize the state's Medicaid letters even applied to them. And if they tried to call the state for help, what happens?
Well, the call centers operated on standard business hours.
Of course.
So if you work a daytime shift in a warehouse, you can't exactly spend 2 hours on hold with a government call center at 2 in the afternoon.
So the cumulative effect of all these barriers was just devastating.
Devastating. And multiple follow-up studies evaluated the Arkansas experiment to see if it achieved the primary political goal, right, which was increasing employment.
Did it work?
The studies found that the policy did not increase employment in Arkansas at all. Instead, it simply triggered a massive spike in the uninsured rate.
Wow.
Yeah, people lost their preventative care, they lost their chronic disease medications, and they faced total financial ruin when medical emergencies hit.
So the Brookings Institution took that hard data from Arkansas, the confusing letters, the broken portals, the transient addresses, and they fed all of it into a dynamic forecasting model. They wanted to see what happens when a policy identical to Arkansas's rolls out across the entire country.
Which is exactly what H.R. 1 is doing right now.
Exactly. And a dynamic model is crucial here, right? Because it accounts for actual human behavior and the real administrative friction over time, rather than just moving numbers around on a static spreadsheet.
Yes, and the Brookings model projects an absolute disaster. In the long run, they predict a nationwide Medicaid enrollment for this specific group will plummet by 34%.
34%.
Yeah. We are talking about roughly 4.5 million Americans losing their health care, driven primarily by paperwork failures and reporting errors.
Okay, since that 34% figure is just terrifying, you would assume local governments are scrambling to build lifeboats before the 2027 federal deadline hits.
You would think so.
And the reactions at the state level are wildly different depending on where you look.
Yeah.
South Dakota, for example, seems to be doing everything possible to get ahead of the wave.
Yeah, South Dakota looked directly at that Arkansas data and really recognized the threat. They estimate that about 12,213 people could lose coverage under the new federal rules.
Which is about 4% of their expanded Medicaid group.
Exactly, which perfectly mirrors the actual 4% non-compliance rate from the Arkansas surveys. So they're basically betting they can eliminate the red tape errors and only lose the people who genuinely fail to work.
Okay, so how do they hit that target?
Well, the South Dakota Department of Social Services is already executing this very aggressive communication campaign. They're not waiting until 2026.
They're starting now.
Right now. They are actively coordinating with tribal representatives, local doctors, community advisory councils. They want providers to, warn patients during routine checkups and actually help them gather their exemption paperwork months in advance.
So they are trying to solve the communication breakdown face-to-face, rather than relying on letters that might just get lost in the mail.
Which is a highly pragmatic approach.
It is. It really is. But then you pivot to Missouri, and you find this explosive political battle that threatens to make the red tape problem even worse.
Yeah, Missouri is really the epicenter of this conflict right now. So back in 2020, Missouri voters actually passed a citizen-led ballot measure to expand Medicaid in their state. The public explicitly voted to broaden health care access.
But now, conservative lawmakers in Missouri are advancing a new constitutional amendment to lock the strict H.R. 1 work requirements permanently into the state constitution.
Exactly. Representative Chappell argued this constitutional amendment is necessary to mirror federal law, but also to balance the state budget. He basically believes that rigorously enforcing these work rules will shed enrollees and save the state millions of dollars.
And the financial savings for the state could be substantial. But the human cost of that rigorous enforcement is equally massive.
Huge.
Princeton University actually ran the numbers for Missouri. They estimate that 130,000 Missourians could lose their health care coverage under these new rules.
130,000 people.
Yeah. And state Democrats are sounding an alarm about the exact same administrative burden that crushed Arkansas.
Because, think about it. If South Dakota is preparing lifeboats, Missouri kind of seems to be dismantling the Coast Guard. Who is actually going to process the paperwork for 130,000 people?
That is the million-dollar question.
State Democrats are highlighting this severe workforce shortage. Missouri simply lacks the administrative personnel to handle the impending avalanche of monthly reporting forms.
And it's getting worse, right?
Oh, yeah. The situation is so strained that the governor recently recommended cutting 173 income maintenance staff positions.
You're kidding. Those are the specific state workers tasked with determining Medicaid eligibility and processing these complex verification forms.
Exactly. You have 130,000 citizens who will suddenly need their monthly work hours manually verified, and the state is cutting the exact personnel trained to do it.
That just guarantees a bottleneck. It's the Arkansas portal disaster amplified.
It really is.
And the sheer political toxicity surrounding these work requirements is already causing massive collateral damage in other places. Look at the deadlock in Mississippi.
Oh, Mississippi. Yeah, that provides a really stark example of how this debate just halts all other progress. In 2024, Mississippi lawmakers attempted to pass a bill expanding Medicaid to roughly 200,000 low-income residents.
Right.
And the State House actually successfully passed a bipartisan expansion bill.
But when the bill reached the state Senate, lawmakers amended it to include a really stringent work requirement.
Yes. And during the negotiations between the House and Senate, conservative leaders drew a hard line. The Senate Medicaid chairman repeated his stance relentlessly. No work requirement, no expansion.
So what happened?
Because the two sides absolutely refused to compromise over the inclusion of the work rules, the entire legislative effort just collapsed.
The bill died.
The bill died. Those 200,000 low-income residents received zero coverage. The debate over how to administer the safety net basically prevented the safety net from being deployed at all.
Which is it's a tragedy. So we have South Dakota's proactive outreach, we have Missouri's looming administrative bottleneck, and we have Mississippi's legislative graveyard.
Yeah.
But all of these state-level projections share one massive silent assumption.
Right, the economy.
Yeah. The Princeton estimate of 130,000 people losing coverage in Missouri assumes the economy stays relatively stable. What happens to this massive bureaucratic machine when the economy crashes?
Well, the Brookings Institution dedicated a significant portion of their analysis to macroeconomic conditions, and their warning is incredibly blunt. If a recession hits, Medicaid work requirements shift from being an administrative hurdle to a destructive force.
The red tape multiplies exponentially.
Exactly.
Okay, wait, I have to challenge that, though. If unemployment spikes locally and, say, a major factory closes its doors, those workers obviously can't magically find 80 hours of work. Doesn't the federal government build a pause button into a law for economic crises?
They do. H.R. 1 does contain a provision for economic downturns. It allows states to request temporary hardship exemptions for counties experiencing severe unemployment.
Okay, so if a specific county hits, like an 8% unemployment rate, the state government can petition Washington for a temporary pause on the rules.
Right. But that is a highly reactive, slow-moving measure. The true hidden danger during a recession isn't actually the unemployment rate itself.
What is it?
The hidden danger is data.
How does data become dangerous during the recession?
Well, we have to look at how states intend to track those 80 hours without drowning in paperwork in the first place, right?
Thanks.
To avoid repeating Arkansas's catastrophic failure with the manual online portal, most states plan to utilize automated verification systems. They link the state Medicaid database directly to existing state tax and payroll records.
Oh, I see. So it's like an automatic toll booth transponder. If the state computer sees you paid income tax on a 40-hour-a-week job, it automatically pings the Medicaid system, verifies your 80 hours for the month, and you literally never have to log into a broken website.
Precisely. The automated system protects you from the bureaucracy. But when a recession hits and people lose their jobs, their payroll data vanishes from the state system.
Oh, no.
The automatic verification fails, so suddenly the state computer flags you as non-compliant.
So the moment your car breaks down, the state revokes your automatic toll pass.
Yep.
You are forced to pull over and manually fill out paperwork on the highway while cars just speed past you. Because you lost your job, the system dumps you right back into the manual reporting pool.
Exactly. Tens of thousands of newly unemployed individuals are suddenly forced to manually navigate those complex, glitchy reporting portals to prove they qualify for a specific exemption.
Like receiving unemployment benefits or participating in a recognized job search program?
Right. They have to acquire and upload all this documentation at the exact moment their lives are in total chaos. The administrative burden on the individual skyrockets right when the population is most financially vulnerable.
And we have to factor in the state's financial reality during a recession, too. When the economy shrinks, state tax revenues plummet, state budgets tighten aggressively.
Very aggressively.
So if a newly unemployed person fails to navigate the manual portal and loses their federal Medicaid funding due to a paperwork error, the state absolutely will not have the spare cash to step in and fund their health care locally.
No, they won't. And it basically triggers this cascading system collapse. Well, a recession forces more citizens to seek Medicaid assistance because they lost their employer-sponsored insurance, right? But simultaneously, fewer people can be automatically verified by the state because they lost their paychecks.
Right, the data vanishes.
Exactly. Therefore, vastly more people fail the manual reporting process and lose coverage. And the state government possesses zero financial capital to catch them. The Brookings model suggests a standard economic recession would cause the disenrollment numbers to skyrocket far beyond that initial 34% projection.
Wow. We have covered a massive amount of ground today. Let's try to synthesize the core tension defining this policy.
Yeah, it's a lot to wrap your head around.
It is. So on one side of the scale, federal lawmakers executed H.R. 1 with a very clear, ambitious economic strategy. By mandating 80 hours of worker training, they're aiming to save American taxpayers $344 billion.
Right, and they want to aggressively motivate able-bodied adults to re-enter the workforce, build skills, and eventually achieve financial independence.
But on the other side of the scale, you have the historical reality of Arkansas and the really sophisticated modeling from Brookings. The data overwhelmingly suggests that the individuals losing their health care are not refusing to work.
No, they're simply losing a lopsided battle against profound systemic barriers.
Right. Confusing notices, lack of broadband internet, incompatible work hours, and crashing state websites do not foster workforce participation.
Yeah.
They simply strip the safety net from the most vulnerable.
It's a devastating collision between high-level political intent and the brutal realities of government administration.
It really is. And as we watch states like Missouri and South Dakota brace for this 2027 deadline, it leaves us with one final, deeply unsettling thought for you to consider.
Right. When Congress passed this law, the Congressional Budget Office officially estimated the impact. They projected that approximately 10% of targeted individuals would lose their eligibility.
Okay, 10%.
But the Brookings Institution, by feeding actual human behavior and administrative failure rates from Arkansas into their dynamic model, they predict a massive 34% drop in enrollment nationwide.
And the gap between those two numbers is millions of human lives. So here's the question you have to ask yourself as this law rolls out. If the federal government underestimated the destructive power of red tape by that much on Medicaid, what other safety nets in America are resting on bad math?